Hello everyone. Have you or a loved one been diagnosed with breast cancer? Have you lost a loved one due to this fatal disease? If the answer is yes, then it is essential to know everything about breast cancer. Breast cancer is the most frequently diagnosed life-threatening cancer in women and the leading cause of cancer among women, affecting 1 in 8 women during their lifetime. Our role today is to answer most of your questions regarding breast cancer. Today we have Dr. Lee, who is a leading doctor at Seoul St Hospital. He's going to discuss with us everything about breast cancer from an experienced medical point of view. I am Uma, and before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Hello, Dr. Lee. Nice to meet you. Can you please present yourself?
Hello, my name is Lee Young-jo, who works in the breast surgery department of the Catholic University of Korea, Seoul St. Hospital.
Nice to meet you. Dr. Lee, today we'll be talking about breast cancer, right? So first question, what are the most common symptoms presented by patients when they come to you?
Breast pain is the most common symptom that patients complain of when they visit the breast surgery department. Breast pain can occur at all ages, mainly in premenopausal women. Symptoms range from very weak to unbearably severe symptoms. The cause of breast pain vary widely, but in general, it is often due to changes in female hormones according to the menstrual cycles, and pain can occur due to lumps or benign tumors in the breast, and rarely breast cancer.
All right. So, can you talk to us about what are the kind of benign breast diseases?
Positive breast disease refers to all the diseases except cancer among the diseases that occur in the breast. In general, the most easily found disease in benign tumor, such as humps on the chest or fibroma, is a phenomenon in which a small water bag containing water in the breast or breast occurs, and treatment is generally not required. However, this lump can cause pain depending on the menstrual cycle, can be found through tooth or breast ultrasound. Fibroma is the most common benign tumor that can occur in a woman's breast, and is generally a symptom of touching a lump that is soft and moves well like rubber. Fibromas do not have any special symptoms, so they may be accidentally found during examination. Treatment is not required, but it should be removed if it is more than 2 to 3 centimeters in size, stands out on the skin, or causes extreme pain. Sometimes similar symptoms are diagnosed as follicular. Petroglyphs are similar to fibroids, but they continue to grow in size without limit and grow more than 4 to 5 centimeters. Petroglyphs are positive and do not become malignant, but some continue to grow in size or metastasize to other organs. In the case of these malignancies, they may need to be removed because they continue to grow in size.
So, what diseases most often turn into oncology or cancer?
Most of the symptoms or positive diseases described above are unlikely to develop into cancer later. However, these are diseases that are difficult to distinguish exactly whether they are positive or malignant during the diagnosis process. For example, atypical tubularism, atypical lobular proliferation, and atypical papilloma are the cases. These atypical cells are diagnosed through biopsy, and there is some possibility of developing cancer in the future. In some cases, cancer cells that have not been found in biopsy are hidden, and surgical treatment is required.
So, Dr. Lee, what is your definition of breast cancer?
Breast cancer refers to all types of malignant tumors in the breast. Some of the tissues in the breast grow abnormally, and some metastasize to other organs. Breast cancer is currently the most common cancer in women globally, also in Korea. Most breast cancers occur in the mammary ducts over 90%. Cancer cells grow in this tube, and when cancer cells fail to penetrate the mammary duct, it is called intraepithelial cancer. If cancer cells come out through this mammary duct, they are classified as stage 1 or higher breast cancer. Depending on the size or lymphatic metastasis, stage 1 to stage 4 are determined, and the cancer cells metastasize to other organs are classified as stage 4 breast cancer.
So, what are the methods of diagnosing breast cancer?
Breast cancer can be diagnosed through a method called mammography and breast ultrasound. Mammography is a method of diagnosing a woman's breast through X-rays by pressing it with a wide plate. This is the most basic method, and breast cancer is diagnosed through tumors, lumps, or microclassification symptoms in the breast. However, women in childbearing age, premenopausal women, and the Asian women have dense breast tissue. These breasts are called dense breasts, and in this case, it's difficult to find hidden tumors because the picture comes out white when mammography is performed. In this case, the tumor is identified through the breast ultrasound.
So, what are the different methods of treatment of breast cancer, and what does it depend on?
Breast cancer treatment is very diverse. Breast cancer is not a single disease, but a comprehensive disease caused by several cells and a wide variety of properties. So there are several treatments that fit this, which are largely divided into two treatments. The first is a treatment that eliminates cancer, called topical treatment, and the second is a systemic treatment that works throughout the body. Topical therapy includes surgical treatment and radiation therapy. The most fundamental treatment for breast cancer is surgical treatment. In the past, when breast cancer was diagnosed, surgery was performed to remove all breasts at all. But since 20 to 30 years ago, breast preservation has been performed to remove bumps while preserving the shape of one's own breast. However, at the time of diagnosis, if the lump is very large or there are multiple breast cancers at the same time, the breast may not be preserved. Recently, surgery is performed to shape the chest again for patients who have to undergo surgery to remove all of their breasts. There are many ways depending on how you rebuild your chest. In general, there's also a way to rebuild using prosthetics, back fat, belly fat, etc.
So, doctor, is there any predisposition to the mammary gland diseases? For example, genetics?
In general, it is difficult to say the cause of breast cancer in one way, and there are several causes in combination. A commonly known risk factor for breast cancer is the exposure period of female hormones. It is known that the longer the exposure period to female hormones, the higher the probability of developing breast cancer. For example, early menarche, late menopause, late first childbirth, or never given birth, or breastfeeding, breast cancer, incidence increases due to long exposure to female hormones. It is also known that eating habits such as high fat and high calories, excessive drinking, obesity, and smoking are related to breast cancer.
Okay. So what is exactly the hereditary anomaly of gene BRCA1 and BRCA2?
In addition to the aforementioned risk factors for breast cancer, genetic mutations are sometimes found in 3 to 5% of all breast cancer patients. It's a gene mutation known as BRCA, which restores our body normally. When DNA is damaged by a cause, BRCA automatically recovers it. However, if the function of this gene is lost, or partially modified due to mutations, the ability to recover when DNA in our body is damaged is lost, which causes cancer. With this genetic mutation, the probability of developing breast cancer increases to 70%, and the probability of developing ovarian cancer increases to 40 to 50%. Angelina Jolie is a typical example. There was a family member in her family who had a history of breast cancer and ovarian cancer. So she did this mutation test and found that she had this mutation gene. So Angelina Jolie did not develop breast cancer, but she underwent a procedure to resect both breasts as a precautionary measure. But not everyone can get this genetic test. Currently in Korea, you can get a BRCA gene test if you have breast cancer and have more than one family member with breast cancer, or if you have breast cancer on both left and right at the same time, or if you have ovarian cancer and breast cancer together. If you have the BRCA mutation gene, you are more likely to develop breast cancer and ovarian cancer. Therefore, the patient can undergo surgery to proactively respect the breast and ovaries, take a drug called tamoxifen, which reduces the incidence of breast cancer. In addition to these active treatments, there are cases in which early treatment is performed when cancer is found throughout checkups every 6 months to 1 year.
Okay. So let's talk a little bit more about the prognosis of breast cancer, the survival rate, the reoccurrence, and the mortality.
Breast cancer has a very high survival rate for patients compared to other cancers. Since early screening is actively conducted, patients with intraepithelial cancer or stage 1 and stage 2 breast cancer have a survival rate of more than 95%. Some breast cancers may reoccur, and about 5 to 30% of them have different reoccurrence rates, depending on the writer. The reoccurrence of breast cancer can be divided by where it reoccurred. If it reoccurs in the breast, it is called local reoccurrence. If it reoccurs from lymph nodes near the breast, it is called regional reoccurrence. And if it reoccurs in other organs, it is called remote metastasis reoccurrence. The survival rate in the future varies depending on the type of reoccurrence. It is important to detect and treat breast cancer patients as soon as it's possible in the event, such as a reoccurrence through a reoccurrence test every 6 to 1 year, even after treatment is over.
So how can a female prevent breast cancer?
Reducing risk factors is the best prevention. However, the patient does not know when she will start menopause, or when menopause will begin, and she cannot control it. In particular, you don't know how many children you will have, or whether you will not have children. Therefore, obesity, excessive drinking, smoking, etc., caused by westernized eating habits should be controlled through your own efforts. Maintaining an appropriate weight and eating a healthy diet should be best to prevent breast cancer.
All right, that's it for today. Thank you, Dr. Lee.
Thank you.
So today we learned many things about breast cancer in detail, such as its symptoms and treatments. Thank you for joining us once again today at Cloud Hospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.